Hello, and welcome to the Orthodontic Products Podcast. I'm your host, Allison Werner. On this episode, sponsored by Ormco, we have with us Dr. Michael Mayhew, an orthodontist in private practice in Boone, North Carolina. He's here to talk about the launch of Ormco Digital Bonding and how it has impacted his treatment planning workflow, his cases, and his practice. Here's our conversation. Dr. Mayhew, thanks for joining me.
Thank you for having me.
To start, can you tell me a little bit about your practice and kind of the course of your career?
Well, I am a dual trained pediatric dentist and orthodontist and started doing all this myself. And over the years, we added pediatric dentists and other orthodontists. And fortunately, we're able to build a great practice in a small rural area in Northwest North Carolina.
Great. Well, we're going to be focusing in on bonding today. So I'm kind of curious to get your experience with bonding over kind of the course of your career. What has your experience been?
Yes. So I found that as our practice was growing, my time chairside was in high demand. And I was trying to evaluate a way that we could increase our practice efficiency, add procedures that were more delegatable to staff. And through utilization of some consultation with practice advisors and consultants, we started looking at the concept of indirect bonding. And at that time, it was more of a process that utilized our what we would call in-house indirect bonding, or a process that we utilize more of our staff. But we found that that bogged things down quite a bit. And that soon led to my working with other companies in a digital process in around 2003, 2004. So something we've been doing for over 20 years.
I'm curious, overall, would you describe your practice as kind of digital or technology forward?
Very much so. I can owe some of that to a son who is in the networking business and in the orthodontic networking system in orthodontic practices. I would see something or be intrigued by something that was starting to arise in the orthodontic industry, and I could share that with him, and he could be more insightful to me about where this could go in my orthodontic practice. So very, very interested in high technology. We had one of the intraoral scanners, one of the first intraoral scanners. We've had CBCT in our practice for over 15 years. Just very forward thinking in all the technology that we can utilize in our practice.
Well, the reason I asked that question is because we're going to talk about Ormco Digital Bonding, and that is, leveraging the latest technology, and we're talking about your history with bonding. So, the goal of this system is to improve bracket positioning and streamline that practice workflow. So, the system is leveraging the company's Damon Ultima brackets, the Spark software platform, which will be familiar to Spark clear aligner users, and Ormco Jigs technology. Now that's the official description of what Ormco Digital Bonding is. Can you tell me in your words, what is it for you in practice?
Right. Well, let's step back a little bit, and I have been utilizing the Damon orthodontic appliance basically since it hit the market. But we knew there were issues with the passive self-ligation bracket. We knew it helped us a great deal early on in treatment because we had a large lumen where the wire set within the bracket. But as we progressed with treatment, the finishing slowed us down. We had a lot of play in the wire bracket interface that sometimes we would not be able to optimize the alignment that we'd like to get. The last few years, Dr. Damon has worked on eliminating that play within the bracket. And so now there's a greater premium on placement of the orthodontic bracket, particularly the Damon Ultima. So we've learned that if we can, it was designed, first of all, to be at FA point, or the center of the tooth along the long axis. Well, that may be easy for some people to find. It could be challenging during the daily workflow of a practice if you're rushing and moving along quickly to achieve that optimal bracket positioning. So now that increased my interest with Ormco in stating we knew we had a bracket that needed to be placed optimally to maximize its benefits. And we had a Spark aligner software platform that we could possibly use to help us place those brackets. And that marriage between the Spark Aligner platform and the Damon Ultima bracket led us to creating the Ormco Digital Bonding system that we have today.
Okay, so talk to me about what stands out to you when using that software when you're planning the bonding.
Right. Well, first of all, the Spark approval platform, I believe it has been shown by many orthodontists to be much simpler. At least it has, in my opinion, for our practice than other leading softwares that we've used for aligner systems. And so it's a simple system. And basically, a lot of orthodontists obviously are already accustomed to approving aligners and approving the setup that they receive from the technicians. And so this software for our fixed appliance system determines the FA point or the optimal location that the Ultima bracket should be positioned. And so when we get the approvers cases back to be approved, it's a much simpler process. And being aware of how the software works and the simplicity that the technicians allow us to do by doing a great job of positioning those brackets, there's a lot less time involved for the orthodontist. So we have a single platform that you're able to submit both aligner cases and indirect bonding cases to Ormco. The technicians follow your design of the for the case, and there's a short latent period where they're working on that process before it gets back to you, and a much more efficient approval aspect, and you're able to visualize with the brackets, all the brackets in the optimal positions where those teeth would end up.
And then once you've submitted your plan, how long does it take to get the jig back from Ormco?
Ormco's goal is to be able to provide the jigs, the delivery system, delivery carrier system within a 7 to 10 day work period. Of course, that would be dependent on how quickly the doctor gets to the case to do the approval.
So, talk to me about the jig technology, which this indirect bonding relies on. What stands out to you about that carrier design of the jig?
Correct. One of the indirect bonding systems that Ormco had in the past was Insignia, that had a milled carrier delivery system, and sometimes that would not fit as optimally as you'd like. Our current system is 3D printed, and it's a softer material, if you will, and it is designed with receivers that allow the brackets to be seated firmly within the carrier system, and the ability to place those onto the teeth is a cap that actually extends both buccally and lingual, that gets a very, very stable result for you. Plus, if you do have one, we always recommend placing that initially in a dry state just to check the fit. And if there's a rocking point, or perhaps a tooth has erupted a little bit more over that week or so time period, then you can use scissors to just cut that particular bracket carrier off and do it individually. So actually, it's very versatile. It fits awesome. And as you're doing the bonding process, there is not a custom base. So you're using composite on the bracket base, as most people would be accustomed to doing when a direct bond. And as you seat the jig, as I said, it seats very well. It provides three surfaces that you can go around and clean any flash, any extra glue that may extrude from placement of the jig. And then it's readily light cured. It's a great process.
What has your staff's experience been with the bonding? Because I imagine they're doing much of this.
They are. That's one of the great benefits, and that's what got me so interested in it. As an orthodontist, I was creating the treatment plan, creating the tooth movement digitally. And so once we've approved that, we're going to get what we approve. That's what we have noticed during our clinical trials, doing the Ormco digital bonding process clinical trials. My staff was accustomed to doing full tray bonding systems. and you just bond them on. You can't see really what you're doing very well. And then as you take them off, you see how successful you were. With this process, they did note initially it took a little more time because they were probably more careful with it and there was a new process. But I just told them, if it's a little more time now, it's going to save us time later clinically because we anticipate fewer repositionings and fewer wire bends in finishing the case. But the staff love the concept of doing the indirect bonding. They feel more involved in particular cases and it makes them more proud of the accomplishments they can achieve in their jobs.
Well, my next question was going to be, how have you seen cases progress with this new indirect bonding? And you talked a little bit there about how you've had fewer wire repositionings. And I imagine the D bonds are not, such a problem. But can you talk a little bit more about how it's actually impacting cases and what you've noticed?
Sure. You mentioned D bonds, and one of the first questions that I get from orthodontists is, are the brackets staying on? And typically, we have seen a few D bonds, very few, I should say, D bonds once we remove the carrier jig system at the initial bonding. And we may see some trauma points where maybe they're biting down on brackets, and we try to protect those areas. But we've not seen a high level of bonding failures. And typically, for my opinion, in my opinion, if we don't see something happen within the first month, then that means it's maybe more abuse as than to the bracket system than the bonding process itself. We initially tried this with the Damon Q2 appliance and tested it out before we started using it with the Ultima. But the Ultima cases that we have finished to date, we're averaging maybe one or two repositionings and very few wire bends. If we do wire bends, they're typically more so in the posterior because in the Damon Ultima system, those brackets are more passive in those particular areas. So it's greatly improved our clinical flow of treating those patients.
How has this workflow streamlined kind of your office from a practice management perspective? What efficiencies have you seen there?
So the biggest efficiency is that the doctor does not have to be chairside for the bonding. There's different states and different laws that talk about whether something is delegatable like this, and each orthodontist would know their own specific concept there. But it's just freed us up for the 15 minutes or so that we would normally sit chairside, and we're able to implement other procedures where the doctor is perhaps more valuable to be used chairside instead of placing brackets when we can digitally design the case and have the staff be able to place the brackets for us.
Since this platform or this workflow does utilize that Spark software, are you treating any hybrid cases? And if so, how does the ability to work within one software platform impact that treatment planning and the course of treatment?
Well, that's a great question because there is a lot more discussion on hybrid treated cases, and I have done hybrid cases at this point in time, not with the Ormco digital bonding concept. It is on the way, though. It's one of the future things that we want to incorporate that in. But there are aligner cases that we recognize some of the challenges we may have using aligners. Not just will the patient wear them, but are the aligners most or more efficient in treating certain cases better than others? Whereas, are there fixed appliances that are more efficient in treating certain things? What I have found over the last several years, and this has been something we've done independent of the Ormco digital bonding process, is a lot of maxillary aligners and at the same time placing fixed appliances or braces on the lower, either to finish the entire case that way or in very challenging malalignment cases to utilize fixed appliances first and then finish that patient with spark aligners. And so being able to streamline these two concepts together will really be a workplace positive once Ormco gets that final aspect of the Ormco digital bonding together.
If you had to talk to someone who is looking at integrating this for the first time and maybe doesn't have a lot of experience with indirect bonding, what would your advice be to them?
I talked about this just recently in a conference that Ormco had in Chicago. Number one, you do need to get your staff on board, and that means proper training, not just hand them something and say, go do it. And the orthodontist or the management team needs to be on board with the full support. Ormco plans and has in their plans for the regional or the area representatives to work with each office in helping to implement. But the training process itself, as I mentioned before, you're already accustomed to using the Spark aligner system, hopefully. And so all you're doing is working with a digital treatment concept of fixed appliances within that same platform. And then staff are typically already used to or accustomed to preparing the mouth for either direct bonding or indirect bonding, whichever case you're using. And you're going to find that they will accept the Ormco Digital Bonding carrier jigs much better than any other system they've used before. So it's just a matter of training and being supportive to the staff that this process can be a much improved technique for them.
What does it mean to you overall to have this aspect of your clinical workflow be digital?
Well, I guess number one thing that parents and the patients see is a huge marketing concept that they see this as a just high technological systems that we utilize in our practice. You know, we have intraoral scanners, we have the CBCT X-rays, your computerized patient management system, and patients and parents see this as a huge streamline in your treatment options. And when they can visualize the end in mind when you're showing them the setups with the teeth already aligned, and we do that. We like to be interactive chairside, showing the parents what we can do and what we've done to plan for their treatment. It's a big win in terms of the technology that they perceive that we're involved in.
Well, my final question is, what excites you about the future of orthodontics?
Wow. Well, number one, I don't think they're going to get rid of us as orthodontists. I hope
I agree
not.
with that.
I hope not. We're just working. I remember Ormco several years ago did a study, particularly for adults, that if we could do treatment within a 12-month period of time, they would do anything to be able to accomplish that within that time frame. What I have found in being able to be more efficient, not only with the digital bonding, but also with the Damon system, our cases are treating out more efficiently, faster than what patients had anticipated. They always think they're going to be, particularly parents were in treatment maybe 2.5 or 3 years. That was my experience being treated. And now we're able to treat people in 14, 16, 18 months, depending on the difficulty of the case. So I think that if patients know that they can be treated correctly and properly, but more efficiently due to the technologies that we have, I think that's going to be a huge boom to the practice and specialty of orthodontics.
Great. Well, Dr. Mayhew, thank you so much for joining me today, and I really appreciate you offering your insight into Ormco Digital Bonding.
Well, I appreciate you having me, and it's an exciting field and something that even though I've practiced many many years, I'm still very excited about being a part of it. It's fun.
Great. Well, thank you.
Thank you.
As always, thank you for joining us. Be sure to subscribe to the Orthodontic Products Podcast to keep up with the latest episodes, and be sure to check out orthodonticproductsonline.com to keep up with the latest industry news. Until next time, take care.